Symptoms may not appear until a tumor has grown to a size where they can cause issues. Colon cancer is frequently referred to as the silent killer. In the US, there are over 100,000 new instances of colon cancer each year. In actuality, it causes up to 50,000 fatalities annually and is the third most frequent malignancy in both men and women. Large intestine cells in people with colon cancer develop abnormally and grow uncontrollably. Even though it's impossible to predict with certainty if colon cancer will manifest, there are several early symptoms that could be concerning. The warning indicators presented in this video could range from subtle to overt. Please be aware that everything discussed in this video is objective, fact-checked, and approved by licensed healthcare professionals before we move on. So let's get started and discuss the 9 early symptoms of colon cancer. 1. Changes in bowel habits. The average age at which colon cancer is most likely to develop is 60. Although younger people can develop colon cancer, it is more common in people over 65. Colon cancer frequently manifests first in bowel movements. A colon that is functioning normally has bowel movements every day or two. If there's any blood in the feces, it should be soft, brown, and easy to pass. It can be something to watch out for if you notice any changes in how frequently you use the restroom or if your stool gets hard and difficult to pass. 2. Diarrhea. For those who have colon cancer, diarrhea or loose stools are common problems. The passage of 3 or more unformed stools in a 24-hour period is referred to as diarrhea in medical terminology. Diarrhea is a symptom that can also be brought on by other illnesses, such as inflammatory bowel disease, lactose intolerance, and irritable bowel syndrome. According to the National Cancer Institute, some persons may have diarrhea as a result of a parasitic or bacterial infection in their colons. 3. Constipation. It goes without saying that the colon is in charge of eliminating waste. It is also in charge of how well our food absorbs nutrients and water. This may result in the colon becoming obstructed and unable to operate normally. Constipation is the end outcome, which may be quite unpleasant and uncomfortable. Constipation may not first seem to be a big deal, but it can be an indication of colon cancer in its early stages. In fact, our research found that more than 80% of people with colon cancer had constipation prior to their diagnosis. Numerous factors, such as medications, adverse effects, and a lack of exercise, can contribute to constipation. It might be challenging to distinguish between ordinary constipation and a more dangerous condition like colon cancer. Speak with your doctor if your constipation persists for more than 3 days, especially if you are also having additional symptoms like bloody stools and stomach pain. If you've enjoyed our videos so far, please hit the like button and subscribe to our channel so you won't miss any of our next educational films before we move on to the next ailment. 4. Blood in your stool colon. If caught early, cancer is one of the most curable diseases. 95% of colon cancer patients survive 5 years after diagnosis. Unfortunately, colon cancer will strike 1 in every 20 Americans at some point in their lives. The likelihood of survival is better the earlier it is discovered. Stool blood may be a precursor of colon cancer. The portion of your digestive system that retains stool before it is expelled from the body is called the colon. Numerous cancers, as well as other diseases such as ulcerative colitis, diverticulitis, and hemorrhoids, can result in bloody stools. The most common cause of blood in the stool is inflammation or damage to the large intestine. Additionally, bleeding from other areas of your digestive system, such as stomach ulcers, may be the cause. Certain medications, including antibiotics like ciprofloxacin, antidiarrheal medications like lactulose or iron supplements, might also result in bloody stools. 5. Bleeding from the rectum. The presence of rectal bleeding could indicate colon cancer. Your big intestine, which is around 5 inches long, ends with the rectum. It's where your body gets rid of trash. However, rectal bleeding is a pretty frequent symptom, and the majority of people who have it do not have colon cancer. Hemorrhoids and anal fissures are a couple of additional conditions that result in bleeding in this area. A polyp or other growth on the surface of your colon could potentially be the reason why you're bleeding from the rectum. 6. Unexplained bloating or abdominal pain. Genetics or lifestyle decisions, such as eating patterns and exercise routines, can increase your risk of developing colon cancer by up to 30%. 10% to 15% of all occurrences of colon cancer are genetically caused, whereas other variables like poor diet, obesity, smoking, and alcohol use increased risk by 5% to 10%. One of the most typical signs of colon cancer is bloating. It could be a sign of another ailment unrelated to cancer, or it might appear in the early stages of a tumor. Bloating, which can be brought on by gas, is a sensation of fullness or swelling in the abdomen. Additionally, certain foods or medications may induce it. If you find that eating 3 substantial meals a day causes your abdomen to feel bloated, try eating smaller meals more often throughout the day. This should help manage blood sugar levels and help prevent bloating brought on by overeating. 7. Feeling constantly tired. Colon cancer symptoms frequently appear gradually and without any obvious early warning indications. Feeling exhausted is a fairly regular occurrence and can be brought on by a variety of things, such as staying up late or not getting enough sleep. However, if you experience fatigue more frequently than normal and persists even after a restful night's sleep, it may indicate a health issue. The colon is in charge of eliminating waste from the body through feces. Toxic accumulation in the digestive system can happen when this process is slowed down or inhibited. If this persists over time, the colon wall may develop malignant tumors. If you frequently feel exhausted and experience other symptoms like bloating or abdominal discomfort, this may be a precursor to colon cancer. 8. Sudden weight loss. The location and stage of the tumor influence the symptoms of colon cancer. Although it can also happen for other reasons, sudden weight loss can be an early symptom of gastrointestinal disorders like colon cancer. Notably, it's totally normal to have lost some additional weight if you're an older adult and have recovered from a disease. Colon cancer may be present if you dropped more than 10 or 15 pounds over a period of time. 9. Feeling full all the time. A good diet can reduce your risk of getting colon cancer, but it might not be enough to stop it from happening. Exercise is also essential because feeling full even when you haven't eaten anything could indicate a problem with your digestive system. Bloating, constipation, diarrhea, and other digestive problems brought on by colon cancer can make it challenging for people to eat properly. These symptoms are typically more manageable than other colon cancer symptoms initially and are frequently milder. In fact, if you experience any additional symptoms, such as weight loss or weariness, you can mistakenly believe that something else is wrong and delay seeking medical attention. The greatest strategy to ward off the disease, whether you're 61 or 16 years old, is to eat wholesome foods, exercise regularly, and keep a healthy weight. Your intestines will remain clean if you do this. You have a higher than normal chance of acquiring colorectal cancer at some time in your life if one first-degree relative, such as a parent, child, or sibling, had it before age 55. Your risk is higher than average if 2 first-degree relatives have colorectal cancer before age 55. Compared to other races and ethnicities in the U.S., African Americans have the highest chance of having colon cancer, even if this might be caused more by access to screening tests than just biology. Remember to call your doctor right away if you have any of the symptoms listed above. Remember that these might not be symptoms at all, but rather preliminary indications of colon cancer. And if you do possess any of the aforementioned risk factors for colon cancer, be sure to ask your doctor if colonoscopies would be the best course of action for screening. Like the video? For more educational videos like this one, please click the like button and subscribe to our channel. I appreciate you coming. Our goal is for you to be healthy.